What depression actually does inside your brain in 3D. Your brain is physically shrinking right now. If you have clinical depression, your hippocampus loses up to 20% of its volume. Your prefrontal cortex stops communicating properly, and your neurons are literally drowning in stress hormones. This isn't just sadness. This is your brain under attack. Let's see exactly what depression does inside your brain in 3D. First, the chemical imbalance. Look at the synapse, the gap between two neurons. In a healthy brain, neurotransmitters like serotonin, dopamine, and norepinephrine flow smoothly, sending signals of pleasure, motivation, and emotional regulation. But in major depressive disorder, serotonin levels drop by up to 50%. Dopamine barely reaches the receptors, and norepinephrine becomes depleted. This is your brain's communication system failing. The result? You can't feel pleasure. That's anhedonia. You can't focus. That's cognitive dysfunction. And you feel exhausted even after sleeping 12 hours. Now here's the scary part. Depression physically reshapes your brain structure. Look at this hippocampus. It controls your memory and emotional regulation. In chronic depression, the hippocampus shrinks by 8 to 10% on average. Some studies show up to 20% volume loss. The prefrontal cortex, your brain's CEO that controls decision-making and planning, shows reduced activity and decreased gray matter density. That's why simple decisions feel impossible when you're depressed. And look at the amygdala, your fear center. In depression, it becomes hyperactive and enlarged. Your brain's alarm system is stuck in the on position, flooding you with anxiety and negative emotions 24/7. If this is making sense, hit that subscribe button right now. Drop a comment below. Have you experienced depression? What did it feel like? Your story might help someone else. And send this video to someone who needs to understand what's happening in their brain. But here's the good news. Neuroplasticity. Your brain can heal. Your hippocampus can regrow. Your prefrontal cortex can reconnect. Look at this process called neurogenesis, the birth of new brain cells. Your hippocampus produces thousands of new neurons every single day, even during depression. Antidepressant medications like SSRIs work by increasing serotonin availability in your synapses. But medication isn't the only path. Exercise increases BDNF, brain-derived neurotrophic factor, by up to 300%. BDNF promotes neuron growth and synaptic connections. Therapy, especially cognitive behavioral therapy, literally rewires your neural pathways. Studies show that after 12 weeks of CBT, the prefrontal cortex regains activity and the amygdala calms down. So here are the clinical depression warning signs. Number 1, anhedonia. You can't feel pleasure. That's dopamine depletion. Number 2, cognitive fog. You can't concentrate or remember things. That's hippocampus dysfunction. Number 3, persistent fatigue that doesn't improve with rest. That's inflammation and cortisol dysregulation. If you're experiencing these symptoms for more than 2 weeks, your brain needs help. This isn't weakness, this is biology. Talk to a mental health professional. Your brain can heal, but it needs the right intervention. Now you know exactly what depression does inside your brain in 3D. Smash that like button, subscribe for more brain science, and drop your biggest takeaway in the comments. Your brain can heal. See you in the next one.